A stroke can strike anyone, but the risk doubles every decade after 55. In the United States alone, more than 795,000 people suffer a stroke each year, and most of them are first-time episodes. What makes stroke so dangerous is not only how suddenly it strikes, but how often the warning signs are missed or dismissed as something minor, like fatigue, stress, or aging. Yet the truth is that your brain cannot survive without oxygen. And when blood flow is blocked or a vessel bursts, millions of brain cells begin to die within minutes. That is why recognizing the symptoms quickly and acting fast is the only way to save life, independence, and dignity. In today's video, I will reveal 10 early symptoms of stroke in the elderly, explain why they happen, what they feel like, and why they must never be ignored. These signs may look small, but they are your body's desperate cry for help. Knowing them could save your life or the life of someone you love. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Part 1. Numbness, when the body goes silent. Sudden numbness is often the very first warning of a stroke. It can appear in the face, the arm, the leg, or even the hand and foot. Many seniors describe it as a tingling sensation, like pins and needles, while others simply lose all feeling. What makes stroke-related numbness different is that it almost always affects one side of the body, while the other side remains normal. This happens because blood flow to one hemisphere of the brain has been interrupted, and that side of the brain controls the opposite half of the body. When brain cells lose oxygen, they can no longer send signals to the muscles or skin, and sensation disappears. Families may notice their loved one massaging or shaking the numb area, trying to wake it up. But this is not circulation from sitting awkwardly. It is a neurological emergency. According to the Centers for Disease Control, sudden unilateral numbness is present in more than 60% of stroke cases. The risk is greatest if it appears with other symptoms like a drooping smile or slurred speech. I recall a 72-year-old woman who thought her hand had just fallen asleep after knitting. Minutes later, she could not lift her arm at all. By the time she reached the hospital, the clot had grown, leaving permanent weakness. Numbness is not harmless. It is your brain telling you that part of it is shutting down. If this surprised you, wait until you hear about the next sign. Confusion, where the mind itself begins to fade. Part 2. Confusion. When the mind clouds without warning. Confusion during a stroke can look like forgetfulness or distraction, but it is far more dangerous. Seniors may suddenly appear puzzled, have difficulty making decisions, or be unable to understand what is happening around them. They may look lost in a familiar place or ask the same question repeatedly. This happens because blood flow to the frontal or temporal lobes is interrupted, disrupting memory, reasoning, and comprehension. Imagine the brain as a symphony, where each section must play in harmony. When oxygen supply is cut, one section falls silent and the whole piece collapses. Families often mistake this for dementia or fatigue, but stroke-related confusion appears suddenly, not gradually. A woman may be discussing her day clearly and then stop mid-sentence, unable to recall simple details. Studies from the Journal of Neurology confirm that acute confusion is present in nearly 40% of elderly stroke patients, especially women. The tragedy is that loved ones often wait to see if it improves, losing the critical treatment window. I remember a 68-year-old patient who suddenly could not remember her daughter's name. The family thought it was stress. Hours later, she suffered a major ischemic stroke that left her with lasting memory deficits. The brain cannot afford hesitation. Sudden confusion means oxygen is not reaching the cells that store identity itself. If this sign is ignored, the damage may be permanent. And when confusion strikes, it is often followed by difficulty understanding language. The next symptom we must examine, Part 3, difficulty understanding, when language slips away. Language is one of the most delicate functions of the human brain. When stroke strikes, comprehension can vanish in seconds. Seniors may shake their heads, wrinkle their eyebrows, or say no repeatedly when asked questions. They may stop talking altogether, or their answers may make no sense. This happens because areas like Wernicke's region, responsible for processing spoken and written language, are starved of oxygen. Without fresh blood, the brain cannot decode words, numbers, or sentences. To families, it may look like stubbornness or distraction, but it is neurological failure. A classic example is asking a person to follow a simple instruction, like raise your hand, and they look blank or lift the wrong object. This is not disobedience. It is the brain unable to translate sound into meaning. Research published in Stroke found that more than a third of stroke patients show impaired comprehension in the first hours. In elderly women, especially, this symptom is often missed, attributed to hearing loss or inattention. I recall a 70-year-old patient who could no longer understand the numbers on a phone keypad. Her family thought she needed new glasses. In truth, her brain was starving. She was in the middle of a stroke. Difficulty understanding is not subtle aging. It is the collapse of networks that define communication. And when comprehension fades, severe headache may be the next cruel warning. Part 4. Severe headache, when pain signals a storm inside the brain. Unlike common headaches that build slowly and respond to rest or medication, a stroke-related headache appears suddenly, often described as the worst headache of a person's life. It can involve the scalp, neck, or behind the eyes, and it may be accompanied by nausea, vomiting, or sensitivity to light. This type of pain is most commonly associated with hemorrhagic strokes. When a blood vessel ruptures and blood spills into the brain, the sudden increase in pressure damages delicate brain cells and triggers intense pain. Elderly patients without any history of migraines who suddenly clutch their head and complain of unbearable pain should always be treated as a medical emergency. Research from the American Heart Association shows that 40 to 50% of hemorrhagic strokes begin with a thunderclap headache. I recall a 69-year-old woman who woke in the night screaming from pain, holding her head. Her husband thought it might be sinus trouble. By morning, she was unconscious. She had suffered a massive hemorrhagic stroke. Severe headache is not to be brushed aside. It is the brain's alarm that something has ruptured within, and as pain grows, balance often falters, leading us to the next symptom, sudden loss of balance. Part 5. Loss of balance, when stability vanishes in a step. A stroke often disrupts the brain's ability to coordinate muscles, causing sudden imbalance. Seniors may stumble, trip over nothing, or suddenly clutch furniture to stay upright. What once felt natural now feels impossible. This happens because the cerebellum and brainstem, which control coordination, are deprived of oxygen. Even minor clots can throw the system into chaos. Families sometimes mistake this for arthritis, neuropathy, or even intoxication. But stroke-related imbalance is abrupt and extreme. Research from the British Journal of Medicine confirms that nearly half of all cerebellar strokes present with sudden loss of balance. One elderly woman I treated suddenly fell backward while reaching for a cup. She had never fallen before. At the hospital, scans showed a small but dangerous clot in her cerebellum. Acting fast saved her mobility. Loss of balance during a stroke is not clumsiness. It is the collapse of a finely tuned system that guides every step. And as balance fails, coordination often disappears entirely, leading to the next symptom. Sudden loss of coordination. Part 6. Loss of coordination. When movements no longer connect. Coordination allows us to move smoothly, to stand, walk, write, or button a shirt. During a stroke, this ability can vanish, leaving seniors clumsy and unable to perform simple actions. The brain's motor circuits, especially in the cerebellum and parietal lobes, depend on oxygen-rich blood. Without it, the signals between brain and muscles become scrambled. A person may try to pick up a spoon and miss, or their hands may shake uncontrollably. Families often mistake this for Parkinson's disease or fatigue. But stroke-related loss of coordination comes on in seconds. A 75-year-old woman I recall suddenly could not hold her teacup. It slipped from her hands repeatedly, though her strength seemed intact. She was in the midst of a stroke. Studies show that coordination loss in elderly patients triples the risk of falls and injuries in the months following. Recognizing this symptom early allows treatment to restore blood flow before more functions collapse. And often, dizziness accompanies this breakdown, making the world itself spin violently. Part 7. Dizziness, when the world spins without warning. Sudden dizziness, especially when severe, can be a hallmark of stroke. Unlike mild lightheadedness from standing too quickly, stroke-related dizziness is often vertigo, a spinning sensation that may cause nausea or vomiting. This happens when the cerebellum or brainstem is deprived of oxygen, disrupting the brain's ability to process signals from the inner ear and eyes. Research from the National Institute of Neurological Disorders shows that dizziness is present in nearly half of all cerebellar strokes. Sadly, many of these are misdiagnosed as ear infections or migraines, delaying treatment until it is too late. I remember a 76-year-old woman who felt the world spinning while cooking. She thought it was vertigo and rested. But within 30 minutes, she collapsed from a cerebellar stroke. Delays cost her speech and coordination permanently. The lesson is clear. Do not ignore sudden dizziness, especially when paired with double vision or imbalance. The next warning sign often linked to dizziness is sudden vision changes. Part 8. Vision changes, when the eyes reveal a silent stroke. Vision depends on smooth connections between the eyes and the brain. When stroke strikes, these pathways may be cut off, leading to blurred sight, double vision, or sudden blindness in one eye. Seniors may suddenly complain that they cannot read, cannot see one side of the room, or that objects appear distorted. This is not an eye problem. It is a brain problem. Research in neurology shows that 2/3 of stroke patients experience vision loss during or immediately after the event. A 70-year-old woman I treated could no longer see the left side of her plate. Her family assumed it was her glasses, but scans revealed an ischemic stroke. Acting late meant permanent vision loss. When vision changes suddenly, always treat it as a stroke until proven otherwise. And when eyesight dims, language often follows. leading to trouble speaking. Part 9. Trouble speaking, when words slip away as a stroke begins. Speech is one of the first functions to vanish during a stroke. Seniors may slur words, use the wrong terms, or be unable to speak at all. This happens because Broca's and Wernicke's areas, which control language, lose their oxygen supply. Without them, thought cannot become words. Families often dismiss this as fatigue or confusion, but slurred or incoherent speech is one of the clearest signs of stroke. The American Stroke Association warns that sudden language problems must always trigger an emergency call. I recall a 69-year-old woman who told her daughter, "The sky is falling on the table," when she meant, "I want to eat at the table." Minutes later, she could not speak at all. Quick action saved her. But delay would have cost her language forever. Trouble speaking is not harmless. It is the brain in crisis, and often it appears alongside the final critical symptom and sudden weakness. Part 10. Weakness. When the body suddenly refuses to respond. Weakness during a stroke often affects one side of the body. A senior may suddenly drop a spoon, drag a leg, or smile with only half the face. This hemiparesis happens because the motor cortex is deprived of oxygen and can no longer send instructions to the muscles. More than 80% of ischemic stroke patients present with sudden weakness. According to the National Institute of Neurological Disorders, ignoring it can mean permanent paralysis. I remember a 74-year-old grandmother who suddenly dropped her playing cards. She laughed it off as her arm being tired. Minutes later, she collapsed from a major stroke. Quick recognition could have saved her independence. Weakness is the body's most visible cry for help. When it appears suddenly, it is never safe to wait. Call emergency services immediately. Doctor's final words. After walking you through these 10 early signs of stroke, I hope one truth is now clear. A stroke does not wait. It does not give you time to think. And it does not forgive hesitation. The brain is the command center of your life. And when its blood supply is interrupted, millions of cells begin to die within minutes. That is why sudden numbness, confusion, vision loss, dizziness, slurred speech, or weakness must never be ignored. They are not inconveniences. They are alarms that demand immediate action. The good news is that stroke is treatable and often preventable. Studies show that patients who arrive at the hospital within 3 hours of symptom onset have far better outcomes and fewer disabilities. Families who know the FAST or BE FAST method can save lives by recognizing facial droop, arm weakness, speech problems, balance changes, and eyesight loss. When you see these signs, do not wait. Do not hope it will pass. Call emergency services right away. Acting fast can mean the difference between a full recovery and a lifetime of disability. Prevention is equally important. Control blood pressure. Manage cholesterol and blood sugar. Stay active with daily movement. Avoid smoking. Limit alcohol. And nourish your body with a diet rich in vegetables, fruits, and whole grains. These simple steps protect your heart and your brain at the same time. I want you to remember this. Your body still remembers how to heal, even after a stroke. The brain has an incredible capacity to adapt and recover with the right care and rehabilitation. But recovery begins with awareness. And awareness begins with you. Share this message with your loved ones. Teach them the signs. Do not let ignorance steal years of life and independence. Now, I would love to hear from you. Take a moment to reflect and share one thing you have learned and plan to apply in your own life. Let us support each other on this journey toward better health. If you enjoyed this video, comment 1. If not, comment 0. And do not forget to like, share, and subscribe so you never miss another senior health tip.